Hello, my name is Mr. Nduka Ozo. I am the Project Director, Center for HIV/AIDS and STD Research, CHISTA. CHISTA is a non-governmental organization that was established in the year 2000. Our purpose is to address the socio-economic concerns of the people in the rural areas and other poor communities in Nigeria. We also conduct research into human behaviors that accelerate the HIV/AIDS infection in the communities. But over the years, our mandate have expanded to cover other important health issues such as hepatitis, TB, malaria, health financing, and even universal health coverage. CHISTA has contributed immensely in the control of and management of HIV/AIDS in Nigeria through our partnership with some various organizations like MTN Foundation, the Irish Aid, National Agency for the Control of AIDS, NACA, Institute of Human Virology, World Bank, and other organizations, etc. We have worked in about 14 states in Nigeria, including the FCT. We have worked in Lagos, Bauchi, Adamawa, Taraba, Borno, Kano, Delta, Imo, Anambra, and others. We are partnering with also the Northeast Development Commission by reducing comorbidity on HIV/AIDS and viral hepatitis. CHISTA and her partners, we tested over 95,000 people in the Northeast on viral hepatitis, especially hepatitis B and C. Within that period, we also procured drugs for the treatment of hepatitis B and C and vaccinated over 50 people against hepatitis B surface antigens. Faced with the problem of managing hepatitis B in the Northeast, CHISTA and YGC, that is Yakubu Gowon Center, working with the Northeast Development Commission, we procured 2 viral load machines which we installed in Yobe State and Taraba State. The machines were later configured to test for COVID-19 virus in the Northeast. Over this period, CHISTA has managed projects and activities worth over, to be precise, 1 billion naira, because even only the 2 viral load machine then was over 400 million naira. So CHISTA has served as ad hoc managers for Institute of Human Virology, where we manage over 2,000 ad hoc staff in the Northeast and North Central in Nigeria under the program SHAPT 01 and SHAPT 03, funded by USAID. That project ran in Kano, Adamawa, Taraba, and other about 13 states. We also supported antenatal care services in Bauchi Specialist Hospital, Infectious Health Center, Tashambabiu. We worked in the IDP camp for the management and combating malnutrition by providing therapeutic and supplementary feeding. We created our own food package and rations where we ensure that food were served to people at the appropriate ration and time, and we helped to reduce the long queues and sufferings of the IDPs and getting food on time. Some of the projects we have implemented include the working with Yakubu Gowon Center on viral hepatitis in the Northeast. We worked with IHVN on a program called Action Plus Up, and the program is supported by USAID. What we did there was provided community health care services for IHVN in the communities. We also ensure that case managers and case manager coordinators support operational 000 and ensure adherence to appointments and medications to people living with HIV and AIDS. We also developed systems that ensured prompt payment of salaries at when due for this ad hoc staff. We supported TreeShed on a DFeed project, funded malaria project in Lagos and other parts of Nigeria. Working with MTN Foundation, we created awareness by publishing the only HIV/AIDS magazine in Nigeria called Positive Nation.